Hi, this is Mark Struthers. Today we want to explore the future of healthcare in rural areas of the United States. Rural hospitals play a crucial role in providing healthcare to communities across the United States. In this presentation, we'll explore the current state of rural hospitals. We will begin with an overview of the current state of rural hospitals, including infrastructure and accessibility concerns. Next, we will dive into the challenges these hospitals face, such as financial constraints and staffing shortages. Then we'll examine the impact of hospital closures on rural communities. And finally, we'll discuss strategies for survival. Rural hospitals are fundamental to the healthcare system in the United States, yet they are increasingly under threat. Understanding their current state is key to addressing their challenges and ensuring their survival. The challenges faced by rural hospitals have far-reaching effects on local communities. Understanding these impacts is crucial for stakeholders aiming to advocate for rural healthcare. Rural healthcare infrastructure often includes small hospitals, clinics, and community health centers. These facilities are essential for providing primary care and emergency services, but many face limitations in both resources and funding. Over the past decade, many rural hospitals have closed due to financial instability. Statistics show that a significant number of rural hospitals have shut down. Accessibility to healthcare services in rural areas is a significant concern. Patients often face long travel distances, which can delay care and impact the healthcare outcome. Understanding these barriers is vital for developing solutions to the healthcare problems for rural America. Rural hospitals encounter a variety of challenges that threaten their operations. Identifying these issues is crucial for creating effective solutions and ensuring their sustainability. A CHC survey of community hospital executives on financial resilience provided more evidence of the rural hospital's fragile condition. The survey released in 2024 found that only 30% of the respondents reported excellent or good financial health, while the rest ranked average or poor. Another area of concern is the risk of losing tax-supported funding, despite their value to their communities. More and more financially stretched rural taxpayers have voted against approving public funding for their hospitals, and often they are the community that is being served, and it is the only hospital in that community. Many rural hospitals struggle with financial constraints due to lower patient volumes and limited reimbursement rates. Securing adequate funding is essential for maintaining services and operational viability. Rural hospitals often face staffing shortages, making it difficult to provide adequate care. Recruitment and retention of healthcare professionals in rural areas remains a significant challenge. Rural communities often face challenges in maintaining an adequate health workforce, making it difficult to provide needed patient care or to meet staffing requirements for their facilities. Technological limitations can hinder the ability of rural hospitals to provide advanced care. Resource gaps in equipment and facilities can affect patient outcomes and hospital efficiency. Rural hospitals face inadequate payments from private health plans that fail to cover the higher costs of care in a rural community. While the United States attracts patients from around the world for its exceptional medical care, many rural Americans struggle to access basic services as their local facilities fight for survival. This disparity isn't just about proximity of healthcare facilities, it's increasingly about the technology infrastructure that enables modern healthcare delivery. Affect patient care and health outcomes significantly. Residents may experience delays in care, and this leads to worse healthcare outcomes and an overall increase in the mortality or death rate. Consequences for communities, including job losses and decreased access to essential services, which negatively impacts upon the community and the cohesion in the community of services being provided. Communities are finding ways to respond to the challenges posed by rural hospital closures. Local initiatives and adaptive strategies are emerging to fill the gaps in healthcare access. Rural hospitals face a tough balancing act and tight budgets, work shortages, and an aging infrastructure, all while serving communities that may deeply rely on them. But many today are finding creative ways to stay afloat and even thrive in this environment. The Rural Emergency Hospital is a new provider type designated by the Centers for Medicare and Medicaid Services, CMS, to reduce the number of rural hospital closures through innovative payment reform and prioritizing close alignment between outpatient services and rural community healthcare needs. The REH designation is the first new rural provider type since the Critical Access Hospital Care was passed in 1997. CMS published policies governing REHs in 2023, and hospital outpatient prospective payments and ambulatory service and surgical final rules on November 23, 2021. Another strategy is strategic partnerships and regional collaborations, or shared services, partnering with nearby hospitals or health systems to share specialists, equipment, or administrative functions. Next, we have referral networks. By keeping patients within a regional system, in other words, a shared system, rather than losing them to the big urban competitors. For example, Montrose Regional Healthcare in Colorado built a referral network that boosted surgery volumes by 54% in the first year. In the past, CMS, or Medicare and Medicaid, had strict productive standards for rural hospitals, requiring providers to see a minimum number of patients. If the hospital fell short, it led to penalties or reduced reimbursements, which only added stress to running the hospital. As of December 31st, 2024, that has changed. Cost reporting since this time no longer needs to meet productivity minimums. This frees up clinics to focus on meaningful patient care rather than meeting quotas and reduces administrative burdens on the reporting staff. The 2025 CMS final rule reflects a broader shift toward improving efficiency and accessibility for rural health clinics, with several key updates aimed at streamlining operations and boosting reimbursement opportunities. Here's a summary of how your clinic benefits. 1. Faster reimbursements, streamline cash flow. 2. Reduce administrative stress with clearer rules and eliminated productivity standards. 3. Expand billing options and flexibilities for improved revenue cycles. 4. Continued support for virtual care through extended telehealth care rules. At their core, these changes reflect a broader advocacy for accessible, affordable, and streamlined care for rural communities. In years gone by, hospitals provided standalone services and did not cooperate with other types of healthcare facilities, even within their own network. Today, that has all changed. Today, we're embracing technology and innovation of sharing services and sharing expertise, whether this is through telehealth expansion, the use of mobile healthcare units such as mobile CT, mobile MRI, or bringing diagnostics care directly to remote patients, and also AI documentation tools which streamline workflow and reduce clinician burnout. 70% of rural hospitals are having financial problems. This leads to financial audits and debt restructuring to address these problems. That can be a top to bottom review to identify insufficiencies and missed revenue opportunities, or it can be as simple as looking at reorganization. Either way, we need to get some breathing room and allow these hospitals to restructure so that they can provide services to the rural community. Rural hospitals often have trouble in recruiting physicians and staff. To address this, there are different incentive programs and different means of recruiting staff. Some of the ideas are to cross-train staff to maximize your limited number of personnel and what they can do. The other thing is to attract personnel that have the skill levels that you need. And this can be done through a number of different programs, including loan forgiveness, housing support, or special schedules to attract providers, or flexible schedules to attract providers. There are a number of ways to address the staffing problem, but each of them is unique to the community that is being served. Adopting innovative healthcare models such as telemedicine and community-based care can help rural hospitals improve service delivery and patient engagement, ultimately leading to better healthcare outcomes. Hospital administration advocating for policy changes and increased government support is crucial for the sustainability of rural hospitals. Effective lobbying and engagement with policymakers can lead to essential reforms and funding. Administrators, physicians, and employees within a rural hospital need to help build stronger community relationships. Building strong community engagement and partnerships can enhance resources available to the rural hospital. Collaborating with local organizations and stakeholders can foster support and improve healthcare delivery. Building a strategy, we need to analyze successful rural hospitals to identify the lessons they have learned, including the importance of community involvement and embracing technology to meet healthcare needs, and try to duplicate those efforts. To improve the state of rural healthcare, it is essential to replicate the successful strategies of those thriving rural hospitals in different regions. Sharing best practices can lead to enhanced healthcare solutions nationwide and improve our healthcare delivery system. Several rural hospitals have successfully adapted to challenges and are thriving. As we can see, 30% of the respondents in the study were successful. These examples serve as models for how other hospitals can innovate and enhance their services. This portion of the presentation explores the critical transformation of rural healthcare in the USA through strategic technology acquisition and thoughtful implementation. We will discuss the current state of rural healthcare, challenges faced, and how technology can enhance healthcare delivery. We will begin with an overview of the current state of rural healthcare, highlighting the challenges and limitations, Next, we will explore how rural hospitals can strategically acquire technology and implement it effectively. We'll discuss the impact of these changes on healthcare delivery and share ideas on how we can be successful. Rural hospitals often face numerous challenges, such as funding shortages, staff recruitment and retention, and geographic isolation. These barriers can impact the quality of care provided and patient outcomes because all of these factors impact on the cost of providing services. Many rural hospitals are limited in the services that they can provide due to a number of constraints. The constraints might be location, constraints might be financial, the constraints can be on technology and services provided, or on the physician expertise and the staff expertise at the hospital and what types of healthcare services that they can provide.
Healthcare accessibility is vital for rural populations. Improved access can lead to better health outcomes, reduced travel burdens, and more timely care, making it essential to address existing barriers to accessibility. Strategic technology acquisition is essential for enhancing rural healthcare services. In this very fast age of technology and artificial intelligence and computer-aided equipment, we need to keep current. This involves identifying the specific needs of hospitals and finding solutions that are both effective and sustainable. Rural hospitals must assess their unique technology needs to improve patient care and operational efficiency. This involves understanding the specific challenges faced and the potential benefits of the various technologies. Evaluating cost-effective technology solutions is crucial for rural hospitals with limited budgets. It is important to consider not only the initial cost, but also the long-term benefits and return on investment, plus the maintenance. Examining case studies of rural hospitals that have successfully implemented technology provides valuable insights for administrators in rural hospitals. These examples can serve as models for other facilities looking to enhance their services. Integrating new technology into a hospital and their existing environment is difficult and requires a great deal of planning. The implementation phase is critical for ensuring that healthcare technologies are successfully integrated into rural hospitals. Thoughtful planning and support are essential for overcoming challenges, everything from site planning to HVAC, the heating, ventilation, and air conditioning required, and the electrical drops of where the equipment will be plugged and also where we will functionally be able to utilize the equipment in the best manner for providing health care. Integrating new technologies into existing workflows is essential for maximizing their effectiveness. The problem we have here is that many people are satisfied with their existing workflow, and many times they fear integration of new innovations into their workflow. This process requires careful consideration of how changes will impact daily operations and patient care. Resistance to change is common in healthcare settings. Strategies to facilitate acceptance include engaging staff in the decision-making process and clearly communicating the benefits of the new technologies. In order to assess the success or failure of implementing new strategies and technologies into an existing workflow, we need a monitor. Patient testimonials provide insights into how technology has improved their healthcare experiences and also as to how it has benefited the hospital. Community feedback is essential for understanding the impact of these changes on overall health and well-being. Technology can greatly enhance patient care by enabling more accurate diagnosis, improved treatment plans, and better monitoring, leading to overall better healthcare outcomes for rural populations. But to be able to implement this technology requires training and time. The right technology can streamline operations, reduce redundancies, and improve communications within the healthcare teams, ultimately leading to enhanced productivity and enhanced service delivery. With technology, rural hospitals can expand their service offerings, such as telehealth, which allows for greater reach and accessibility to specialized care that may not be available locally. Evidence from innovative rural hospital showcases how strategic technology acquisition and thoughtful implementation can lead to a remarkable improvement in healthcare delivery and patient satisfaction. Learned and best practices from successful implementations can guide other rural hospitals in their transformation journeys, highlighting what works and what to avoid. Transforming rural healthcare through strategic technology acquisition and thoughtful implementation is essential for improving patient care and operational efficiency. By embracing innovative solutions, rural hospitals can overcome challenges and thrive. Thank you for your time and attention, and please subscribe to the Mark Struthers channel